Okay, everyone, welcome. This afternoon, we have Impact of COVID on the Black Community. Our presenter today is Trahern Cruz. He is one of the chairs of the National Green Party. And for more information, you can see our GPUS convention website link. So thank you so much. Trahern, you are good to go. Thank you.
Okay, thank you guys all for joining us. Today we're going to talk about the impact of COVID-19 on the Black community, and when the small presentation is over, feel free to ask questions. As you know, COVID-19 has shut down our country and has caused close to 200,000 deaths in the United States and rising. So it's really having an adverse effect on the Black community. We're going to start today's presentation off with a small a look at a clip from Vox about the U.S. medical system and how it's still haunted by slavery.
There's a bronze whose brilliant achievement carried the fame of American surgery throughout the entire world. He's the guy who created the vaginal speculum, an instrument gynecologist for examination. He pioneered the surgical repair for fistula, a complication from childbirth, and became known as the father of modern gynecology. But that brilliant achievement was the result of a series of excruciating experimental surgeries that he conducted on enslaved women. In a lot of ways, Sims epitomizes the story of American medicine for Black women. It's a system that's failing them to this day. From infant mortality to life expectancy, the racial disparities in healthcare are staggering. The gulf between Black and white might be widest when we look at maternal mortality, with Black women 3 to 4 times more likely to die in connection with pregnancy or birth than white women. And that divide can be traced back to doctors like Sims, who contributed to a long, largely overlooked history of institutional racism in medicine.
Trying to understand a historical problem without knowing its history is like trying to treat a patient without eliciting a thorough medical history. You're doomed to failure.
That's Harriet Washington, a medical ethicist and author who chronicled the intersection of race and medicine in her book, Medical Apartheid. While many of the stark racial disparities in healthcare can be attributed to environmental and economic factors like access to good healthcare, studies show that minority patients tend to receive a lower quality of care than non-minorities, even when they have the same types of health insurance or the same ability to pay for care.
As African Americans, we've been abused for so long, consistently by the system. Why should we trust it? Why should we go to when ill? And that's eophobia. That's the fear of the healer. And inculcated by the behavior of those healers, unfortunately.
It starts with slavery. Doctors relied on slave owners for financial stability. They accompanied plantation masters to auctions to verify the fitness of slaves and were called in to treat sick slaves to protect their owners' investments. In 1807, Congress abolished the importation of slaves and in turn pushed Black women to have more children, to essentially breed slaves. Founding father Thomas Jefferson later wrote, "I consider a woman who brings a child every 2 years as more profitable than the best man on the farm." Around the 1830s, the abolitionist movement led to the rise of what was called Negro medicine, or efforts to identify Black inferiority to justify slavery. And there were polygenists who tried to use both science and the Bible to find proof that races evolved from different origins. The 1830s also marked the beginning of recorded experimentation on Black women's bodies. One doctor performed experimental C-sections on slaves. Another one perfected the dangerous ovariotomy, or removal of an ovary by testing the procedure on slave women. In fact, half the original articles of the 1836 Southern Medical and Surgical Journal dealt with experiments on Black people. And then, of course, there was James Marion Sims, whose reputation is etched in history and on that statue in Central Park. Between 1845 and 1849, Sims began performing experimental surgeries on a 17-year-old slave named Anarcha. He eventually performed 30 operations on Anarcha and more surgeries on about 11 other female slaves. When his male colleagues could no longer assist him in inflicting pain on the women, the slaves took turns restraining one another. Yet paintings depicting Sims, Anarcha, and other slave women presented a subdued version of his experiment. Even though anesthesia was introduced in 1846, this chose not to use it for his experimentation with slaves. His practices echoed one of the most prevalent and dangerous beliefs in medicine at the time, that Black people did not feel pain or anxiety. This book from 1851, titled The Natural History of Human Species, claimed the American dark races bear with indifference tortures insupportable to a white man. Studies released as recently as last year demonstrate that Black people are less likely to be treated for pain, particularly in the ER. There's even one from a children's hospital that found the same to be true for kids. And just this year, Pearson Education, a leading educational publisher, issued an apology and recalled nursing textbooks that included racist stereotypes, like this section that said Black people often report higher pain intensity than other cultures.
Well, what does it mean when you say that someone doesn't feel pain? Among other things, you're speaking about their humanity. These are all part of that suite of beliefs emanating from the 19th century that we still have not shaken off.
So thank you. That was from Vox, and it was about the U.S. medical system is still haunted by slavery, and without slavery there would be no U.S. medical system. So without slavery, there would be no U.S. medical system, because it started with slavery. It started with experiments on Black men and Black women, and so that is the beginning of where we see the racial disparities in the healthcare system begin with slavery. So systemic racism in the U.S. healthcare system began with slavery, continued with some of the experiments that we just heard mentioned, also with the Tuskegee experiment, the sterilization of Black women with Fannie Lou Hamer, lack of access to healthcare, lower care even if they have the same healthcare insurance as whites, misdiagnosis, not prescribed proper medicines, believes that, and also the healthcare system believes that Blacks can tolerate more pain. Pre-existing conditions in the Black community are a result of institutional racism in the American healthcare system. Speaking of the infant mortality rates, 11.3 for Blacks, 4.9 for whites, high blood pressure, diabetes, strokes, heart attack, stress, lack of health care, iatrophobia, which is distrust of the healthcare system. And there's a reason a lot of the video we watched and some of the things I'm mentioning now is why Black people don't trust the healthcare system
and don't want to go to the doctor to receive health care because of the historical racism that has been practiced. And that leads to COVID-19, because some people are not getting checked or even being checked for illnesses that make us susceptible to COVID-19, like high diabetes, blood pressures, heart attacks, stress, and not getting treated for those things because of our lack of trust with the healthcare system due to white supremacy and institutional racism and 400 years of oppression in America. Many Blacks are essential workers, putting us on the front lines with the battle of COVID-19, causing workers to get sick at grocery stores, bus drivers, healthcare professionals, etc. People have become sick or died in nursing homes. And to bring that home, one of our Greens here in St. Paul has a son who was in a nursing home, and he was quarantined 3 weeks before the outbreak and still ended up with COVID-19. He didn't die, but the fact that he was quarantined before he had COVID-19 and then still ended up getting COVID-19 let us know that there's a problem in the nursing homes in Minnesota and other nursing homes about, there have been nursing homes in Minnesota where everybody has died. But in this particular case, he's a young man about 24 years old, but he is paralyzed, ended up getting COVID-19. It was hard for her and other family members to go see him. They kept giving him a lot of natural remedies, things like oranges, fruits, apples, things to help with his bowel movement. And then once he had the bowel movement, he was off quarantine and he was cured of COVID-19. We're very happy about that. So there's a lot of people who haven't been able to see their loved ones because they have been hospitalized. And then once the person is hospitalized, no one can go and see them. And sometimes people are dying alone. Also, children are not in school right now because of schools were shut down during the pandemic or the ongoing pandemic, which led to distant learning. But then there's the digital divide, so a lot of children weren't able to access the curriculum. A lot of people still had to go to work, or some people might not have had the skills. So here in St. Paul, 45% of the children are special needs children. So now they're at home with their parents who might not know how to educate them with those set of issues. So then also there had to be graduations. A lot of people didn't get to go to prom. People didn't get to graduate, or they had to have graduations. How we're having this meeting right now. So those are some of the human impacts that are affecting the Black community. There have also been children or babies who have become infected with COVID-19 also. So seeing how school is going to look in the future is another big issue with COVID-19. The economic impact of COVID-19 has had a devastating effect on Black businesses. 41%, or over 400,000 Black businesses have been lost to the COVID-19 pandemic and shutdown. 95% of Black businesses did not qualify for PPP funding or payroll protection or the payroll protection program funding. And a lot of that was because these Black businesses didn't have relationships with banks in the first place, which has a lot to do with institutional racism again. So certain banks were saying who received PPP funding, these Black businesses had to go through those banks that they didn't have a relationship with to ask for PPP or payroll protection program funding. But the answer that many of them received was that they were dealing with their existing customer base first. And most Black businesses were not part of their existing customer base. The rent freeze is starting to end, so we're going to see homelessness rise in the Black community. Before the COVID outbreak, 50% of the homeless population in America was Black or is Black. So we expect that number to rise once the rents start, when the rent freeze ends. Also, 58% of Black businesses were struggling before COVID-19. So that's a lot of us feel like COVID-19 was happening in the Black community before it became a pandemic. So there was a economic COVID-19, a social COVID-19, and a political COVID-19 that is happening in the Black community. And we really need to hurry up and step up and address it. The solution, and it's part of the Green Party platform, is reparations. So our reparations proposal will call for funding set aside specifically for Black owned and operated healthcare facilities that build trust in our communities. We also say health, wellness, and healing for Black families and communities. So we want these. Here in St. Paul, we used to have a place called Model Cities, or we had Dr. Abrams, who were doctors whose ancestors went through slavery. Those clinics are not there anymore. So like the woman whose child was sick, who was in a wheelchair, and he became sick with COVID, those were Black nurses and Black healthcare providers offering him care, and then they were able to stop him from dying or helping him get better from COVID-19. We also want funding set aside specifically for Black owned and operated businesses to survive the pandemic. So we need to understand the barriers that Black businesses were facing before COVID-19 in the first place and help them deal with that. Most Black businesses only have one employee. So the payroll protection program was really irrelevant to a lot of these businesses. So the next time there's that type of stimulus package created, whoever's at the table on our behalf needs to take that fact into consideration when we're drawing up payroll protection loans or funding. We also need funding set aside to develop housing and Black community controlled co-op housing. And that will help us deal with a lot of the homelessness that we see here in America. And finally, because of our children are not in school and we're having a hard time in schools before COVID, we want the Board of Education of African Ancestry, and the Board of Education of African Ancestry would say with schools that are predominantly Black, would say what the curriculum should be, what the teacher should look like, what disciplinary action should look like, what the recess should look like, what lunch should look like, what should be in the lunch, and things like that. So those are some of the solutions that we feel will lessen the effects of the pandemic on the Black community in the United States. And if there's any questions, we can take those now, or comments.
Yeah, I had a question about like you mentioned like Black communities being affected in COVID-19. Could you add a little to that in regards to the Affordable Care Act? You said that they were in distress before COVID-19, and the ACA was around, and it still is. And I just want you, if you could clarify, maybe in terms of the Green Party platform. I mean, yeah, where they stand with the Affordable Care Act. But could you elaborate at all on how the Affordable Care Act has not been so affordable?
Well, some people can't afford insurance. So if you didn't have, so there was a mandate that if you didn't have insurance, that you would get a penalty, or like $600 each month that you don't have insurance. So that's one issue. Another issue is we support single payer healthcare with the Black Caucus, and I believe the Black community in general supports single payer healthcare. However, single payer healthcare does not address the historical institutional racism in the healthcare system. So it's not going to address the Tuskegee experiment. It's not going to address the experiments it's not going to address infant mortality. It's not going to address the Blacks not being prescribed the proper medication, or people saying that Blacks can tolerate more pain, but it would say that we think it would lessen costs, but it's not going to address the historical disparities like the high rates of diabetes, healthcare, heart attack, stroke, the disparities in the healthcare system. So like the racist part of healthcare needs to be addressed. Single payer is more of a financial, making it more accessible to more people, but there's still more work we need to do on it as far as addressing historical and current racism in our healthcare system.
And this is Diane, the room host. I am taking Stack. You can either put Stack in comments or raise your hands. The order of Stack I have right now would be Margaret Kimberly is up next.
Okay, hi, thank you. Thank you so much for your presentation. I put in the chat an article from the New York Times about Black people being refused treatment, who showed up at hospitals and health centers. I think the story was about Detroit specifically, but people were refused treatment, even as you point out, when we are admitted to hospitals, we are treated worse. But I think there was another problem with COVID, and that was the medical profession not knowing how to treat it. Now there's evidence, as my doctor told me, he said too many people were intubated. So as they learned, they were doing things that were at the very least not helpful and perhaps fatal to people. So I just, thanks for the presentation. I just wanted to add those points. Thank you.
And thank you for adding that. And that just backing up the institutional racism, people being denied care, and then poverty exacerbating the COVID-19 situation in the healthcare system in the Black community.
Up next on Stack is Laura Wells.
So my question has to do with reparations, and some of them that you've been talking about especially affect the people at the community level. And I was wondering, is there also the idea of having reparations at the individual level along the lines of UBI, Universal Basic Income? And so I would love just some more understanding about the possibilities for how reparations could be effected.
So here in St. Paul, we're working with our city councilwoman, Jane Prince, and other community organizations on something called the St. Paul Recovery Act. I think you could read a little bit about it in the Washington Post, and on Unicorn Riot just did a article about that. But like I was speaking about earlier, we used to have here facilities, healthcare facilities that were ran by people whose ancestors went through slavery. So we had Model Cities Health Center was started by Pastor Gloria, who was the pastor at Camphor United Methodist Church, and she started a clinic, and Black people could go there. That's not available to us anymore. We used to have Dr. Abrams. It was another clinic, community clinic, that people can go to and get care that we need, especially from a culturally specific lens. So people that look kind of understand your historical background or culturally specific medicine, not talking about even like herbs or anything like that, just somebody understanding what you go through on a day-to-day basis and understands your humanity. And sometimes that's not taking place in the healthcare system. So we want to, at a local level and at a national level, we want to beef up funding and knowledge, and even when it comes to mental health at healthcare facilities that have traditionally served the Black community. Another something similar to what happened here in Chicago, and this has to do with health too. There were a group of my Democrat friends who received a grant for $50,000 to ban menthol cigarettes. Our proposal with our reparations, this was before Chicago even passed their reparations proposal. We wanted to put a tax on all menthol cigarettes, not just menthol cigarettes, any form of tobacco, and have that put into a reparations fund and be distributed to the descendants of slaves, or when people want to do things like gun violence prevention, that their proposal would have to match up with health, wellness, and healing for Black families and communities. So that would be the reparations trust fund that we would want to get going here. We don't have all the details hammered out, but it's just in its drafts, in its stages, and we want community input. We don't want to we want to build consensus in our community on how reparations should look like. But that piece around having healthcare facilities and reparations at the local level is something we're working on here in the city of St. Paul, and it's called the St. Paul Recovery Act. And so, yeah, that's how that would start. And we also want something at the state level. Ours would be called the Minnesota Migration Act, and then at the national level, they have something called HR 40, but a lot of reparations activists feel that we're already past the HR 40 stage and that we need to start with implementation.
Okay, thank you. And next on stack, we have Cal.
Really excited to see your face, Mr. Cruz. So I had reached out by email probably several months ago now. I've been working on the back end on a lot of data reporting. In the state of Ohio, I had covered the 7-state region, and I have developed a model for distribution of, resources. I mean, so it started with sending gloves out to local healthcare workers. And one of the things I'm hoping to do is to be able to plug some of that work into the Green Party and get folks in the community, where are the resources? How do we get them where they need to be? And I'm really good at the numbers, but I'm not really good at the people part. So I just wanted to let you know I'm in the next phase, and I'm totally ready to help on what I have capacity to help with. And there's a lot of things I don't have capacity to help with, to be honest. But that's one place where I definitely, all of the groundwork has been there for, starting honestly in March, like the day that we shut down in Ohio. So there's a good long backlog of, it's on record, and it can be moved forward from there, and just in a really good position to help. So that's the interest.
Thank you. And I think that's, I think greens around the country that we can help set up, not that we will all do it the same way, but as far as distribution, even having places where you can drop off, where something, every Wednesday or every Tuesday, people can drop off medical supplies. And then we have greens who decide that we'll distribute it on Thursday, or, and then we develop a list of community members that we know who are in need. And then we go and take them those medical supplies, whether they're gloves, face masks, shields. We were doing that when we were doing our protest.
Also, food distribution. If there's any restaurants that Greens have any type of connection with, or any place where you can have people drop off food, and then it's powerful to have somebody show up with a Rise, Resist, Revolt shirt on, delivering you some food or something like that, or PPP gear. So those are things that I think that we can do ourselves in our local community, is drop off and drop off. That you can organize that with, and then build relationship with local businesses where they can have those things. So it helps promote that that local business because you're telling people to go there and drop off things, and while they're doing that, they might buy something. And then we're also helping the community because we're distributing goods and resources that are desperately needed right now. So thank you for doing that, and I'll be in touch too.
Okay, thanks. And next on stack, we have David Rold.
Thank you. Your presentation was really great, Trey, with the history of the racial disparities in the medical system. And I also agree with your solutions for the reparations and the Black community control of healthcare and housing and all the institutions in the Black community. But like the one thing that you didn't get into is like what is causing the COVID deaths? Is it COVID that's causing the deaths? Like, I don't think so. I think people are dying because of these racial disparities and because they're not getting the appropriate treatment for COVID, or some people don't even have COVID and they're diagnosed with COVID and put on the ventilator and killed. And it's just like, you know, this whole thing was planned. It's a genocide against Black people and Indigenous people and elderly people in nursing homes, and they're killing them, and then they're saying it's COVID, and they're using it to justify these like draconian lockdowns things and political repression and the contact tracing that's already being used to like track down protesters from the anti-police Black liberation protests. And so we really need to be clear that like if we didn't have these like racial disparities in the healthcare, that COVID wouldn't be killing so many people, and it's not really that dangerous, and we have to like do away with the masks and the social distancing and all these restrictions that are like making like political change like more difficult. Like we can't even have our in-person convention because they've you know shut down travel. So I just wanted to make that point. Margaret already like you know touched on this, that the treatment isn't correct for COVID, but people are dying from suicide and drug overdoses and stuff because everyone is so freaked out and anxious about this like hysterical fear that they have us in. So thanks Trey.
Thanks, David, for your comments, and I'm conflicted with that answer because the woman I just spoke about had similar sentiments to what you said about her son, who was actually contracted or who had COVID-19.
Uh-huh.
And I've seen reports of people, you know, just on Facebook where somebody's like, well, my mom died of a stroke, but they said she died of COVID-19. So, I mean, I know there's some of that, but then there are people who are actually there are people who are getting sick too. So,
well, that's true. I'm not saying nobody's getting sick, but if the death rate is really like similar to the flu, we don't shut down our whole society for the flu every year. You know, like that's not a long-term solution to having a disease in the community to like have everybody isolating. Like it was okay for like 2 weeks when they were trying to flatten the curve or whatever, but like you can't. It's not like a long-term solution to have everybody wearing masks and staying apart from each other and not having in-person meetings and stuff. You know.
Right, and so even part of this presentation is saying that the Black community was suffering from COVID-19 before anything caused COVID-19. It was just, we call it institutional racism, and the shutdown and what you're talking about just exacerbated that situation. So as far as saying where it comes from, I mean, that goes back to that argument about is it something that happened in a laboratory, or did it happen in a market, or, you know, things like that. And so I personally do not have the answer to where COVID-19 comes from, and I don't think any of us really do, but I do know that institutional racism in the medical feel is having an adverse effect during
Right.
this pandemic and things like that. And I believe that the Green Party has the policy positions beginning with reparations, then beginning with free health care or single payer health care, issues like universal basic income and things like that. So that's why I think it's really important for Greens to get out and lead during this crisis on all of those issues. And police brutality, demilitarizing the police, prevention of police terror, which starts with making sure the police have insurance, and then even eventually just abolishing the police and using that and using some of that money. Like New York, they were taking $1 billion from the police department, and it's like, wow, you guys have more money after that, but that $1 billion should be invested into the people who are affected by police brutality the most, and those are probably the same people who are going to have be affected by the pandemic or COVID-19.
Mm-hmm.
Okay, and next on stack, we have Gil.
You gotta unmute.
Sorry, thank you. I'm going to make a couple comments and then I had a question about reparations. So I wanted to note just a few random things about disparate impacts. So first of all, the impact of environmental racism on outcomes. In other words, pollution and even the building of bioweapons labs in Roxbury and other Black communities. Access to food, healthy food, access to hospitals, access to loans, you already talked about. Even today, you talked about the history of medicine. Even today, when they're talking about testing for these COVID vaccines that they're doing in parallel, they're talking about testing in Africa, and I think that's significant. Note that the school breakfast program was started by the Black Panther Party, and I'm unlike David. I'm for social distancing, but I know, for instance, in New York, police were handing out in Central Park to mostly white people who were not wearing masks. They were handing out masks to them, whereas in the Black community, they were physically attacking people who weren't wearing masks. So just in terms of how social distancing is enforced, there's a racial disparity. And then finally, I just wanted, note the freezing out of health solutions from places like Cuba that weren't used here in the United States, but are being used in the rest of the world. Even recently on MSNBC, the Democrat channel, they were explaining to us how important it is that the COVID vaccine be granted to a U.S. multinational pharmaceutical as opposed to other options. So whose interests are they talking about there? And then finally, on the reparations front, I just wanted to ask, your thoughts on Cooperation Jackson in Jackson, Mississippi, the Black Power Blueprint in St. Louis, Missouri, and the Uhuru movement in general, as models, for reparations.
So here in Minneapolis, not North Minneapolis, in the east side of St. Paul are good examples of food deserts. And like there's only one Cubs and then just a whole bunch of corner stores and stuff like that where you're not going to be able to get fresh food and things like that. So making sure that we have more, even we're working on urban farming, but more access to healthy food in black neighborhoods. Again, pollution. There's a place here called Oxford Rec Center that had, we played football there for years. then Ziggy Wolf, the Vikings' new owner, brought it, and they tested the soil and found out the soil was contaminated and stuff, and a lot of that. So playing football on a contaminated field for over 30 years causes asthma and stuff in the population, which was a black population who played football on that field for 30 years. Then pollution, even we had a place here called Northern Meadows right over North Minneapolis. Recently, like our whole city they had a fire there and the whole city smelled like burning steel and plastic and stuff like that. So definitely those are issues that have to be addressed. When you said other options, I was wondering what you meant, just briefly.
Oh, I was talking about, existing reparations programs like a Cooperation Jackson and a Black Power Blueprint as models for what could be done in other Black communities.
Okay, I'm not familiar with Reparations Jackson. If you have a quick.
Yeah, Kali Akuna, who's a Green Party member, is one of the people leading those, and certainly we can get you in contact with them. And then the Black Power Blueprint, is led by the Uhuru movement. But I think they're models for what the Green Party could also be doing. So that's what I was trying to say.
Okay. Yeah, when you get some time, please send that over.
Okay, and next on stack we have Vegan Jayoti.
Hello, thank you so much for the opportunity, and thank you, Dr. Cruz, for your excellent talk. And thank you for bringing up the food desert. That was going to be my first question. The second question is the mortality of these COVID-19 patients is phenomenally adverse in people who have heart disease, diabetes, obesity, and those diseases are very prevalent in BIPOC people or people with low socioeconomic status. So it's like a double whammy. First, we don't have access to healthy fruits, vegetables, plant-based foods. And second, you have these underlying diseases which make the COVID symptoms which flood the lungs and make these things adverse, so you have adverse outcomes. So it's like a really complex situation. How do we educate folks till we get the vaccine to go adopt a healthy plant-based lifestyle and exercise and take some semblance of control back? Thank you.
Okay. Thank you. I'm actually not a doctor, but I think as far as having access to healthy food, I think we have to have healthy food available for people in communities and access to a grocery store that is selling healthy food. So like I just said, over North Minneapolis, there's one Cubs, and then we had a riot. So at some point there wasn't even you couldn't even go to Cubs, and then if you don't have transportation, you have to go out to you would have to go out to the suburbs. Then you have to make sure you have gas in your car because there's riots, and then the gas stations are closed or boarded up. So just making sure that we have access to foods. I know we can't grow year-round food outside, but I think there's indoor facilities that we can start grabbing up. So in a lot of urban communities, there's things going on. This is another big chance for Greens to lead, and people are looking at us for ideals on how to move forward in COVID-19, but also with police reform and just legislation, period. So like we're actually at here in Minnesota are at the table in discussions about that. But first, the first thing is making sure that people have access to healthy food, and then not blaming the population because they don't have access to healthy food. And then I think we have to start thinking differently after we can't think pre-COVID-19 right now as Greens. I think we must think post-COVID-19, that we're in COVID-19, we're in a pandemic. So a lot of things that we used to think like some of our what does nonviolence mean during a rebellion? What does personal and global responsibility mean during a rebellion or COVID, under the pandemic of COVID-19? Just a lot of these things we have to look at it through a lens that we are in, whether it's what David's concerns were or not. We still have to address things that we are currently in COVID-19, and will probably be in this state for at least the next year and a half. So I think we have, but the beauty about it is the Green Party was already situated to be ready for this pandemic and some of the other things that are happening around it because of our platform, because of some of the policies that we're pursuing. So I think the biggest part of it is access, and then promoting a healthy lifestyle through, and I think the Green Party can do this just spending some funds on our messaging as far as promoting a healthy lifestyle and exercising and things like that.
Okay, thank you. And next up, we have Mitchell on stack.
Thanks. I did a lot of hiring in the 90s, and a lot of people don't realize that when we do reparations, we are going to need to have some contingencies in place for blowback. How do we prevent the Republicans from not just coming back in, or even, you know, the Democrats coming back in and just overrunning it, turning it over, whatever's going to happen. One of the cases that I had with affirmative action that I don't hear people talking about was I would go to hire people. In one case, I was hiring 6 co-op engineers. So before they graduate, they have to complete a co-op where they work as an engineer for 6 months in a company. If they don't get a job, or they don't get their degree. So I hired 6. Of the 6 I hired, 5 were black. And the first issue that I encountered was when I went to the vice president and the HR department, as I get hit with, we already have our quota on protected groups. So anytime you put something else on there, you're putting a target on their head. So with people like me that are willing to hire them, you make it almost impossible for us. And I got good engineers out of it. I was lucky I was able to talk them out of it. A lot of times you aren't able to talk. And I still feel that affirmative action, especially we had one bad instance with somebody who had gotten a degree that did not deserve it. A mechanical engineer that did not know what trigonometry was. And after that, we almost could not hire black co-op students. And, you know, so it just, the reputation can get really bad. Anybody could have a bad student, but that is especially in your head when it feels like it's a forced, you know, something that you could be sued for if you don't meet your quota. So once they meet the quota, they after that, they always feel that the quota is there as an undue burden. Now, when we get hit with reparations, are other people going to start feeling that it is somewhat like the case where how often do you hear people talk about the blowback at the hiring level from affirmative action? As it's not proper to talk about. And I think we do need to talk about it because it's an issue. I've had good engineers that I could not hire because I could not get the approval to hire them. in other cases. And in the cases where they have used it to promote a bad student, it ruins the jobs for 1,000.
Right. So that's why reparations is an affirmative action. Affirmative action was supposed to be something to equalize the playing field. So even like civil rights is not reparations. Civil rights is just for people to be treated civilly or to be treated humanely. Reparations is rooted in the word repair. So people are broken because of from slavery.
Yeah.
And
again, though, the implementation matters. How the people perceive it, and how it gets that control. I'm not saying they're not due the reparations. All I'm saying is that I know and I've seen the backlash that happens when you do try to make the effort. And also, you mentioned growing inside. The first 2 weeks, 500 heads of lettuce need this much space. That's it. 500 plants of broccoli, 500 plants of the first week. This is all they need. And our current growing methods are to grow out in the fields 18 inches apart, rows 3 inches a step. So indoor growing, and I do grow actual food, you can get extremely dense because it takes to maintain a perpetual lettuce supply in my house, it takes 4 square feet. So the first week I only need a 1/4 inch by 1/4 inch. Second week I don't need much more. You know, that only that last few weeks do I need the substantial size. It means more work. We have people to do work. There's no reason for a food desert when we have people that could be doing some manual work, moving things around.
Absolutely.
Especially in Minnesota, because it also means that rather than cooking or harvesting 2 weeks early in California, you harvest the day before it goes to market in Minneapolis.
Wow.
So it's complete, it's healthy, it's tasty, and really doesn't take much in the means of light. It takes 1/10 the amount of sunlight. So sunlight can be broken into electricity and used to raise 8 crops with the same amount of sunlight. And that can be raised 1 set at day, 1 set at night. So 1 acre inside equals 20 to 30 acres outside.
Wow. Yeah, see, and that, so I definitely like to connect with you on some of that.
Sure.
Learn more about that for sure. So we could do some of that up here in Minnesota too. Yeah, and I agree with some of the things Margaret has been saying in the chat about there should have been a lawsuit when you weren't able to hire who you wanted to hire, and that earlier she said that New York hasn't totally defunded the $1 billion, but imagine what that $1 billion could do for people, the schools in New York or the housing situation in New York if we were able to defund the police and use that directly on community.
All right.
Thank you.
Okay, thanks. Next on stack, we have Monte.
Yeah, I just kind of wanted to point out that we're, at least since I've been here, the conversation is kind of at the intersection of 3 very complex things. And all 3 of them are things that we don't really know everything about yet. We haven't done the experiment in many cases. Corona is a good example. I've been following genetic engineering since 1978. And we really don't have the ability to build a virus, but we could breed one. But it would require a lot of animals to host them, and it would be kind of hard to hide. The guy who tracked the virus down to the bats is the same guy who tracked the AIDS back to 1952, and then pretty concretely back to where it was in 1902. And so he's like the top of his field. Everybody else in the field doesn't compare to him and his team. So I'm inclined to say it came from bats. But before I knew that, I was also inclined to say it came from thawing the tundra. We won't probably ever really know that. But we do see this pattern of ducks geese, bringing them down from the Arctic, just as an example. So as much as I know about the subject, I'm not at all willing to say that it wasn't manufactured. So we don't know. And that's pretty much a simple thing. It doesn't matter. Here it is. Black people in Cancer Alley are dying at much higher rates. We can pin down, just like the virus itself, we can take the time to pin down why and then discuss it. Or we can discuss it in the vacuum of knowing, but know that we don't know. And same goes with, like in the last month, I've seen more evidence of institutional racism than I've ever seen before. Handing out white people masks, literally beating up black people because they're trying to go get one. And it's just across the board, and reparations to some degree is a similar mystery in that we're not sure what everybody else thinks is a good idea yet. We need to discuss that, and we need to do it in a vacuum, right? But then there's some things that, like I said, are very simple. We don't need to know where a coronavirus came right now, and we don't, and it'll probably get tracked down in the next 10 years. And we know that regardless of what the details are of why black men are dying faster or more frequently, regardless of the details, we know you can break them all down. Every one that you can break down comes down to racism, institutional racism. And so some of these things are given, but we have to be careful not to spend too much time arguing about the things that aren't given, because we don't know, and you should give me your opinion, and I should give you mine, and then we should try to move on to the next thing that we do know. And reparations to me is all about getting an agreement, a consensus on what that means. And I think, again, in the last month, I've been very impressed, not just with the evidence coming out on institutional racism and how useless cops are, but also on other things like how good the streets and the youth are doing at a proper approach to their problems and looking at good solutions. And so to me, we really are at this pivotal point in time when I might mention, in my opinion, there isn't a single climate change tipping point we haven't already crossed. We are at a point in time where I want to see us try to focus more on what we do know, because I don't think we need to solve the unanswerable questions like the exact mechanics of the virus. Would be nice if we had done enough testing, we'd know more, but we don't know. Those who don't want to stay home could be right. I don't think so, but they could be. And I'd rather not argue that point. I'd rather find a solution. And the reparations / defund the police intersection is so productive right now. And so it's great. And then I want to end with, there's a couple people in Milwaukee and Detroit who really could tell you a lot about urban agriculture. And I'm wishing I wasn't failing on names, but I've hardly been sleeping lately.
Will Allen?
Yeah, that's the one name I was trying to look for, because he's from Milwaukee like me. Yeah. I used to ride the bus past his greenhouse and look at it, all thrown full of stones thrown full of holes, and go, gee, I wish I could afford that. And he did. He did it. And he had the same plans as me back in 1990. The difference is he's been working on them for 30 years, and I don't even have a garden anymore. But he's awesome. What's good about Will is he's got like systems, and that's kind of what we're talking about here when it comes to defund the police as well. Yeah. We're not talking about a single throw this patch on the problem and walk away. We're talking about an ongoing analysis and discussion about what do we want, what can we agree on, and then how do we make that work, and where does it fail? I just wanted to set that out there, that there's so much room for discussion of these issues that we always have to not waste our time making a point like the one I just did.
Yeah. Just to follow up real quick. So, and again, I'm not a conspiracy theorist. I lean towards more that coronavirus is real. I just don't know exactly where it came from. There's a if you go to Google patents and put in coronavirus, there is a patent for the coronavirus that is owned by the Bright company, something like that. So, but I don't know if that's this same coronavirus. There's something about on Lysol that says Lysol kills coronavirus, and that's been
Yeah.
there for years.
Yeah, well, that's it. It's number 19 of the novel ones that a human hasn't had yet.
Okay.
But on that level, that one guy who did track it down to bats, and several other people who are at the intersection of environment and epidemiology, are all saying pretty much what to me is obvious. I mean, I was more focused on the polar ice cap thing because they've been talking about that in climate paleontology, epidemiology kind of cross circles for 2-3 decades. But the fact of the matter is, we're now at a point where 98% of the mammal mass on the planet is either a human or one of our domesticated animals. More than half of that being cows. And so it's really the fact that we've crowded all of wildlife into a few corners that we're now invading, and in many cases taking that dead member of a species intentionally and putting it on the market for a person to eat. But regardless of that, between mosquitoes and monkey bites and everything else, we're pressing right up against what's left of the animal reserves of viruses and bacteria and fungi, and the fact that we're meanwhile also just trashing all the robustness of all the environments. We should expect more pandemics, and debating exactly where this one came from for me is for 5 years down the line when we have use for that information and can track it down right. But again, I'm too much of a scientist on this issue.
Feel free to email me stuff too.
Sorry.
I know there's other people that want to chime in.
Yeah, so it looks like right now we have 3 more people on stack. We can go a little bit over 3:45, but we want to stick as close to that as possible because we have another workshop coming in here at 4. So next we have Charlene on stack.
Thank you. Thanks, Trahern. I hope I'm pronouncing your name right. Is that right?
That's fine, yeah.
Thank you. So I'm a candidate for state representative in Massachusetts, and I was talking with an endorsing organization about reproductive health, and they have a piece of legislation they're promoting, and I wanted your take on it. They have a bill on racial disparities in maternal health. I think that was right at the head of your presentation. Their bill wants to put together a commission to study racial disparities in maternal health. And I'm wondering what your take on that is. Do you feel like we have enough information to just say, here's an agenda of strategies we should be using, and what are those, or what's your take on it?
So, yep, and I think that there's enough research on, like the video that we watched at the top. I don't know if you've seen it, but that kind of explains the history of that. But I think there's enough that we don't need to do new studies, but we should compile all the old previous studies that there are, and even the most recent ones, and we can start, because we'll get into study when we're in a crisis. So I think there's time for implementation of things and prevention and things like that. And so I think, but even gathering that material is a job within itself, and compiling that information of all the studies around maternal mortality and infant mortality and stuff like that. So yeah, I would start more, not saying that the work they're doing isn't good, but if they could move towards just compiling what's already out there, I think that would be a great place to start.
Yeah, because I appreciated the little bit of tape with the author of Medical Partake. It seems to me she probably put a lot of that together. I don't know the date of that book, but yeah, I just, hurry up and wait is not where I'm at.
Right. Yeah, we can't afford to. So if
yeah.
this is the income data, whites have 90% of the wealth, blacks have under 3% of the wealth. So that's another issue with COVID-19. By 2050, will be at zero. So there's just not a lot of time to wait on these issues right now.
Great, thank you.
Thank you for your question too. In any of this stuff, if you guys could please, because it's valuable to us as Greens, the things you guys are working on in your respective cities. So if you could send us those links so that we all can connect to it and maybe use some of that for what we're doing in our own cities too.
Okay, and next on stack, we have Beth.
Hello, greetings. I lived in Minneapolis for 7 years, and so I'm happy to hear you talking about places I actually know where they are. Currently, I'm living in Nashville, Tennessee, and I work at a historically black institution, Tennessee State University. And one of the things, yay, go TSU. One of the things that I've noticed both as a university professor and also as the parent of a school-age child in the public schools is that we talk a lot about safety and what's the safest thing, but we don't say safest for whom. So I have students, when TSU shut down and sent its students home to do online classes, one of the things that became very clear is that they were not in the university. They were safe from being infected in the university, but they were working jobs that outside the university continually because they economically had to work, and those were the jobs that were available to people who had not yet completed their college degrees. So safety does not, so what's safe for me as a middle-class professional who can do all my work by telecommuting is not safe to somebody who has to work in a grocery store or in a hospital or something like that. And likewise, with my daughter, we were able to be at home and be caregivers to her, although since we were working full-time, we really were not very good at the homeschooling side of things. But a lot of people don't have that luxury as well. So when we talk about what's safe and what's appropriate, we really need to think about what is important to people who have economic deficits. And of course, people in the African American community, because of a whole history of racism, of redlining, of limited access to the better paying jobs, to the universities that provide skills for those jobs, although thank goodness for HBCUs or it would be even worse. But access to things like Wi-Fi, my students were relying on the library to get textbooks for the course because they couldn't afford the textbooks and so on. So all of these things. And then I just want to sort of wrap up really quickly with a sort of a food for thought question, is that in the long term, the corporations are going to figure out how to leverage this to get what they want. Larger market share, easing of regulations they don't like. What are we going to leverage this for so we can get what we want?
Wow, and that's a great, so many, to me, the best presentations are when you get great feedback from the people who are participating in this. So I just want to thank all of you for all your comments, because they have really been great and insightful and informative. I was the chair of a group here. I was on a board, and they had me as a Black Lives Matter activist. They put me as the chair of the public safety committee. So we wanted to say, what does public safety look like through a lens through equity if we're dealing with policing? But I think we could take that to other to our schools, hospitals, social services. So like you're saying about, I think this is just a really good issue. Like you say, look, how does this look to who? And we can say that in a lot of different, we can say that in the medical facility, you know, through just when we're looking at systems, who is it benefiting and why? And how do we make them more equitable? And I think this is something that even after the PNC is over, that we need to start having more conversations like this and more discussions like this, so that we can start, because that we're in this time, and people, and I'm not just saying it just to say it, but people are actually looking to the Green Party to lead on these issues. So, and being able to have input from you guys. So I'll be in hearings and stuff with our certain officials, and it's good to be able to get this type of information. So when we are in front of people, that we can tell them, we can deliver the best policy positions, because the Green Party has the best policy positions. But even being able to go deeper in those policy positions, and the only way to be able to do that is by having discussions like this with Greens at the local level and at the national level. But yeah, I think we should look at safety, whether it's public safety, school safety, or medical safety, through the lens of equity, definitely.
Okay, and I actually think we got through everybody I had on the list for STAC. I was off by one person. Did I miss anyone? Okay, this is a great presentation, and I loved all of the questions and dialogue and discussion. Trahern, do you have anything else you want to leave for our viewers in the chat?
Please become a sustaining donor for the Minnesota Green Party. You can go to mngreens.org and click on donate. If you have any questions or any more just information that you want to send to us about reparations, COVID-19, you can send that to my email. It's trahern@mngreens.org, and I'd love to hear from you. We also have a radio show every Sunday that I would like to invite Greens the opportunity, if you're running for office or if you're working on something. I'd like to offer you the opportunity to come on the air and talk about it. And again, just reach out to me at Trahern@mngreens.org. And thank you all for all your great insight and for participating in today's workshop.
Great, excellent. I think I saw your email up top, so I'm going to drop it in right
Can I
here.
get you to put a link to that radio show in the chat, please?
Since you brought up fundraising, I wanted to give the example. We've had hundreds of people joining the Uhuru movement in the last month. White people giving money directly to reparations. It just shows the power of reparations over the anti-racism approach in terms of getting people to actually pony up. So I think the Green Party can follow that model.
Okay, thank you, everyone. And Trahern, did you have a link for your radio program, or how?
I put it in WFNU.org, and it's the Trahern. If you go there, you can click on the Trahern Cruise Show where it says shows.
Okay.
It probably went to somebody person to person, because I didn't see it show up.
Oh yeah, if you change in chat, change the.
I did that twice by accident just now.
An easy slip. Yep.
And many thanks. Even though I didn't catch all of it, I was very glad to get what I did.
Thank you for participating, to all you guys. I learned from you all too.
Okay, I'm going to stop our recording now. Thank you, everyone.
Thank you.